You are working as a salaried doctor and you have been asked to call the health visitor, Jean Butler, as she is concerned about a mother who gave birth to her first baby 10 days ago. It is currently 10:30 on a Monday. You have the following background about the mother and baby.
Hello?
Oh, hello there. Is that Jean Butler?
Yes, it is.
Oh, hello. It's Dr. Cooper speaking. How can I help?
Hi. I went out to visit a young mum who's 10 days postnatal this morning. Her name's Claire Pope. She's 19 years old. This is her first baby. And I'm just a bit concerned about her, basically. I think she's got postnatal depression. She's living on her own. Father of the baby left while she was pregnant. And although she has got family living nearby, there doesn't seem to be much communication between her and her family. So basically, she's quite isolated. She's been tearful, very low. And the baby, although seems quite happy, is very slow to regain his birth weight. And the baby is called William.
Right.
So I'm just concerned for mum and baby, really. Baby is being bottle fed.
Uh-huh.
Visited her, obviously, at home, and the flat seemed in sort of good order.
Mm-hmm.
And I'd just like some advice, really.
Right. Okay. Well, thank you for obviously getting in touch with me. I mean, it certainly sounds like there's lots of issues going on for Claire. So have you been in contact with them a few times, did you say?
Yes,
been
I
to
have.
visit
Yes,
a few
I have.
times,
Yes.
right?
Yes. It was a few days since I'd visited, so just thought I'd go back and do the 10-day postnatal before. Yeah. And was just very concerned that mum was very tearful, though, and just didn't seem to be coping, really.
No. Okay. And are you aware of any history that Claire has of any previous depression or?
No history at all, actually. She's not on any medication, and she's had his acne in the past, so basically nothing of note.
Right, yes, actually looking back through her notes, I can see that is all that she's had in the past, and this is her first baby, isn't it?
It is, yes.
Right, okay. And was, Claire quite open to talk to you about it? Did she recognise that there was an issue?
I think so, yes. I mean, it's difficult fighting back tears, isn't it? But yeah, she was recognising that she did actually need help.
I see. Okay. And do you mind telling me a bit more about the actual conversation you had with her? Did she have any suicidal thoughts at all?
No suicidal thoughts. No, definitely not. Was just very tearful and was just talking, obviously a bit down because father's not around. She hasn't got any family support. But no suicidal tendencies, no.
Okay. And how about with regard to William? What did you sort of feel about the interaction between mum and the baby?
That interaction was very good, actually. Yeah, she seemed a good mum, very caring. As I say, he is bottle fed. He seemed quite content. But, as I say, slow to gain his birth weight, which is obviously a cause for concern.
Yes, and was he full term?
Yes, he was, yes. Yeah, uncomplicated delivery.
Right, okay. And any sort of issues since he's been born, or is it just this slow to regain weight?
No, yeah, that's the only issue, that's right.
Okay. And did you sort of go into her, into more detail with her about her feeding and what she's giving and how often?
Yeah, she seems to be feeding on demand, and seems to be giving 3-4 ounces. William is taking at a time. Doesn't always finish the bottle.
Right.
So, yes, I mean, she's certainly attentive to William. maybe she doesn't persist with winding him and giving him the full bottle.
I see.
So, yes, that might be a reason why he's not regaining his birth weight, because she's not completing the bottle.
Okay. Well, I mean, it certainly sounds as if probably need to assess William. Obviously it sounds as if we do need to see Claire as well. But I think from William's point of view, I think, obviously we do need to see him in the surgery, I would say, and just, make sure there's no other reasons for that. And obviously, get all of his weights and go through everything. Now, in terms of Claire, was she sort of willing? Did you feel to sort of talk to somebody about how she's feeling? Or
I think she would appreciate that. Yes, definitely. I think she would like to. She would like to open up to someone.
Right. Okay. And do you mind me just sort of asking your role, Jean, and how you would what your sort of usual next step in this situation would be? I mean, would you normally be seeing her again quite soon, or?
Yes, I would. Yes, I would see her within the next few days. And
right.
we keep an eye on William's weight as well, and I would use William's weight obviously to as an access to her, and then just gently drop into the conversation. How are you coping? How are things?
Yes.
So just to keep an eye on her as well.
Okay. Well, that's excellent. I think obviously that's definitely what she needs. It sounds as if we also need to perhaps see her in the surgery and have a bit more of a sort of discussion with her about things.
Yeah. I think what I'd probably suggest as well is perhaps her joining a mum and baby group, so she has a little bit more support, perhaps with mums of a similar age, just so she can discuss things in that way as well.
Definitely, no, that does sound like a good idea. So at the moment she's not involved with anything like that?
No, she's not. She's really very isolated, very isolated.
Right, okay. And you obviously mentioned her family are nearby, but she doesn't have much contact with them.
That's correct.
Right, okay. So that's obviously something we need to perhaps explore a bit more as well.
Yeah.
Okay, so Jean, if I could just ask, do you feel that Claire needs to be seen sort of today, or what's your sort of feeling on the matter?
I would certainly feel, yes, she does need seen today.
Right. Okay. I think I'm going to have to. Unfortunately, we've got quite a lot of visits today, so I'm just going to have to have a little look through those and see whether that is something that we'd be able to do. I mean, obviously, I completely appreciate what you're saying, and I think it does sound that Claire needs to be seen quite soon. Do you think that perhaps if we got in contact with her today, that she would be sort of, she would be willing to have a chat over the phone? She have you broached the subject with her at all? Sorry.
I have. I feel it would be more appropriate for her to be seen in the surgery.
Right.
Her and William.
Yes. Right. Okay. That's fine. So actually, then perhaps if we gave her a call and then we could perhaps arrange for her to come down later today.
Sure. Yes. Yeah. I'd feel happier about that. Yeah.
Right. Okay. And was there anything else you wanted to discuss, Jean?
No, that was it entirely.
Okay. No other sort of issues with regard to Claire that we haven't gone through.
No, nothing at all.
Okay, well that's fine. Well, thank you very much for drawing my attention to that. And I would be grateful if you could go and see, obviously continue contact. And obviously we'll keep in touch with you and let you know what's going on.
Yeah, and I'll follow her up in the next 3-4 days.
Brilliant. Thanks very much then.
Lovely. Thank you.
Okay, bye.
Bye-bye.
It is important to take into consideration the level of training the healthcare professional has and to communicate in a clear and uncomplicated fashion. Take time to show that you value the healthcare professional's opinion. Try to be encouraging and supportive of reasonable management plans. Take into account the healthcare professional's role and adjust your expectations accordingly. Communication with other healthcare professionals can be direct and often shorter than with patients.